It comes because of several things. Immunosuppression, one. Other cancers that are metastasizing. If a cancer is metastasizing, cancer cells use a lot of energy and they destroy several cells in your body. So weight loss is a red flag. Now, night sweats, what does it show? We've seen people that have serious infections like tuberculosis, TB. TB comes with severe sweating, mostly at night with fevers. Now, let's check out this, which is important. Let's check it out, which is very important. You are sweating at night and you have headaches. You are not consulting anyone. Mycobacterium tuberculosis, when it is advanced, treating it is complicated. Fatigue means you're not getting enough oxygen and you're not getting enough energy to your body cells. So what might be happening to your body? You might be having something serious, maybe going on through your lungs, or maybe going on through any other system that is giving you energy, like anemias, bone marrow problems. We have types of anemias: microcytic, macrocytic, megaloblastic anemia, all of those categories of anemias. And we will talk about anemia one day, which is a very important topic. HIV/AIDS and immunosuppression. HIV/AIDS is immunosuppressor. So when you have headaches, it means your immunity is going down. Cancers are some part of immunosuppressors. So you have to be screened when you have this. You've seen people that have HIV/AIDS, they go through hospitals and they do CD4 counts, they do serum crack, they do all their viral load so that they can be in a good state of viral suppression. So when you have headaches and you are undergoing these things, it is very important to check out on the doctor. Pregnancy or postpartum stage. Let's talk about pregnancy. When you are pregnancy, the consumption goes up. You are having two lives, you plus the baby. Many things like hemoglobin levels must rise. Your immunity must be strong so that you can bring up a child that is healthy. But when you are having headaches, what does it mean? It means you lack something. Most of the people that have headaches in pregnancy, what they have is anemia. When it is associated with fever, just know there is an infection. Postpartum state, after delivery. When you are getting a baby, there are so many things that happen to you. Ladies, there are so many things that happen to you, and you may get infected. And there are some things like postpartum hemorrhage, abnormal bleeding after pregnancy. You get anemia, normocytic anemia, and then there is this thing that is called postpartum sepsis. You get an infection and then you start having headaches. Now, those are the red flags when it comes to headaches, fever, weight loss, night sweats, fatigue, cancer, HIV/AIDS, and immunosuppression, pregnancy or postpartum state. Let's talk about neurological symptoms. Neurological symptoms. When I talk about neurology, I'm talking about the brain and the nerves. And we talked about the 12 cranial nerves. You remember them? The 12 cranial nerves. A cranial nerve, I usually say, is just like a connector that pushes some signals. You get? That pushes some signals. Let me say this. Like this one is a signal sender, a cable. They are like this. So you take this cable and then it sends a signal like I'm smelling, olfactory. Let's go through the 12 cranial nerves, which is very important. Olfactory, for what? Smell. Optic, for what? Vision. Oculomotor, eye movement, eyelid elevation, and pupil constriction. Trochlear nerve. What is trochlea doing? The cranial nerve number 4. Cranial nerve number 4 is for eye movement downwards, upwards, and inwards. Downwards, going back, and inward, like this. The cranial nerve number 5. What is cranial nerve number 5? Trigeminum. Trigeminum, it's for motor function. Motor function move means muscles, moves eye down and inward, down and inward. That is trochlea number 4. Number 5 is both trigeminal nerve is both sensory and trigeminal nerve is divided into, it comes here, divided into 3. For we call it, the first branch is called ophthalmic, maxillary, and mandible. So it helps the mandible to move, to help you chew. Maxillary is for sensation around your face here, and ophthalmic around. So cranial nerve number 5, facial sensations and chewing. You have to sense your face, so that you cannot have. But let's go to cranial nerve number 6, abducens. Abducens is for lateral, outwards. Lateral, it's called moves the eyes laterally outwards. It's for muscles of your eyes. Facial nerve is number 6, both facial extension and 2/3 of taste of your tongue. That is for facial and saliva. These things happen like this because we want to have a good relationship when it comes to innovating and coordinating things. We are at number 6. Let's go to number 7. Number 6 is abducens, which is controlling in and outward. But number 7 is the facial nerve. Number 7 is the facial nerve, both for facial expression and taste, 2/3 of the tongue. So sorry for that mistake. Number 6 is abducens for eye movement. Number 7 is facial nerve for taste and both expression, the muscles of expression. Here we have the buccinator and the other muscles here that makes you, we have vestibulocochlear. Vestibulocochlear means hearing and balance. It helps you have the balance, so it innervates the hearing and balance, the sound innervation. Number 9 is glossopharyngeal. Of course, glossopharyngeal means the tongue. 1/3 that remains after facial has innervated, the glossopharyngeal picks it and it innervates part of the tongue downwards. Glossopharyngeal. And parotid secretions. Parotid are the ones that bring out salivary saliva. Parotid secretion. Some chemicals come from the salivary glands and parotid glands. Now, cranial nerve number 10, vagus, swallowing, speech, parasympathetic supply, thoracic and abdominal supply. The heart depends on the vagus nerve, for parasympathetic, slowing down, Now, let's go to cranial nerve number 11, accessory nerve. When I say accessory, you say shrugging the shoulders and turning the head. Shrugging the shoulders and turning the head. Cranial nerve number 12, the last one, hypoglossal, tongue movement. You cannot move your tongue when the cranial nerve number 12 has a problem. Why are they called cranial nerves? Why are they called cranial nerves? Because this is the cranium, they are inside the skull. So the cranium nerves inside the skull. Let's go. How many are there? 12. Ophthalmic, optic, oculomotor, trochlear, trigemina, abducens, facial. After facial, what do you have? Vestibulocochlear, and then we have, after vestibulocochlear, we have glossopharyngeal, vagus nerve, then we have accessory nerve and hypoglossal. There are 12. Why am I going through them? Because we want to talk about the nerve neurological signs and symptoms. Weakness of an arm, you are having a headache and weakness of an arm, numbness, confusion, and altered sensation, altered consciousness. Seizures, difficulty in speaking, double vision, loss of balance. You know, you will be able to know which nerve has a problem, like weakness of the arm or leg. You know, you start noticing there is a cranial nerve that shrugs the shoulder and turns the neck, and maybe it has the problem. Which one is that? Accessory, 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 uh, uh, cranial accessory, which is cranial nerve number 11. So you start noticing, oh, on this part, accessory comes from this hair, this place of the. This is how doctors make diagnosis. By the way, it comes from this place. So this person might be having headache, maybe through a tumor or something. That's why we send people for MRI even with a headache. Numbness is another thing. Confusion and altered state, seizures, difficulty in speaking, cranial nerve, glossopharyngeal, and hypoglossal. You know, and if you can't speak when your tongue is not moving. Double vision, optic, cranial nerve number 2. You know, double vision. Something is wrong there. And loss of balance, vestibulocochlear. You see, these are neurological signs when you have a headache. They tend to tell you that you are having a head injury. Neurological symptoms injure the cranial nerves. You see, it's a it's a it's a it's a it's a thing. Yes, Sammy. Paul, can I call you after 30 minutes, please? Sawa. Okay, ask uliza tu. Mm. Uh, it depends. Let me call you on 30 minutes after that. Now let's continue. And so the double vision, optic. We are talking about neurological functions. Let's talk on onset. How disease, how did this thing start? Onset means how it started. Eh? Onset, how it started. Was it a thunderclap? And then you heard poo, poo, poo. You know, migraines with aura. You remember what we talked? Migraines are divided into migraines only and migraines with aura. So, was it a thunderstorm? Categorize these things so that you can know how to treat them. Migraines with aura are not treated only with painkillers. You may find that you may need something that is antidepressant like serotonin agonist. You know, those ones are very important. May indicate bleeding in the brain such as subarachnoid hemorrhage, thunderclap. When you are going up and then you bleed and then you get the sudden headache like pop. You see, so the onset defines the character and the type of headache. Why? So that the management can be done well. Like when you are having a hemorrhage, you know that is an emergency. And when it is an emergency, the questions that the doctor asks first when you reach the hospital are very important. They know, the doctor will know whether to send you for an MRI or whether to send you in theater direct. So headaches are very important. Old age and onset. First headache at the age of 50, or does it just come every time? You know, raises concern for conditions such as giant cell arteritis, and stroke or brain tumors. These are very important. Onset, gradual, thunderclap, you know, which age are you in? 50s, people in 50s, 45 and going above 65, mostly they suffer from conditions like arteritis, you know. So categories of this is very important, very important. Pattern change or progressive headache. Pattern change and progressive headache. Let's talk about increase frequency or severity. Frequency, how does it come? Is it severe or is it new types of headaches? What are the new type of headaches? Have they changed pattern? You know, are they coming now in a different dimension and time? Which time do they come? Mm? Are they like previous headaches? Headaches that do not respond to usual treatment. Sometimes you take paracetamol, it works, but over time you start having headaches that when you take NSAIDs, they don't work. If you take the other ones, they don't work. Analgesics are totally different, and the way we say you take care of headache is very different. It's very different. So let's talk about something that is important and headache. Sometimes position uh, uh, means a lot. Position means a lot. In which way? How does position means a lot? It's because maybe you are lying at the wrong position and then you feel the headache. But when you are standing, it reduces. Worse when standing suggests low cerebrospinal fluid. Worse when standing. Worse when lying down may suggest intracranial pressure, tumors, hydrocephalus. Someone told me hydrocephalus is in kids alone. No, we learn about it and it is even in adults. Let's talk about participated by extortion and valsalvas, triggered by coughing. Sneezing, heavy lifting. When you are lifting something, people that go to the gym, you lift something and you feel like it will, you want to return that thing down, you know straining, straining exercise and sexual activity. Sometimes when some people are having sexual intercourse, when it comes on optimum, you feel like you can bust out your head. It means there is something on hormonal imbalances and some problems that you yourself cannot know. But these are very important things, and I know these are the questions that you should ask yourself, or the doctor will ask. Yes, will ask when you are having a head. Sorry. Okay, let's talk of papilloedema, swelling of the optic disc in the eye, seen on eye examination, and back. The capping goes from 0.1, 0.2, 0.3, above 0.5, which is bad. Start having blood vision and headaches. It shows intracranial pressure and requires urgent assessment. It's very important you check on these things. Very important. There are some other alarming features that are not good when it comes to headaches. Headache after head trauma. Your head has three types of traumatic types: compression, contusion, and concussion. Concussion and contusion, and then you get contusion is where something has pursued inside the brain. But now concussion is whereby nothing has pursued, but you have like a bang somewhere and you not have any injury, but inside there is a problem called concussion. And then you have compression. Compression is whereby there is something that is growing like a tumor, or there is fluid buildup in your brain like hydrocephalus, whereby the absorption is less than the production of cerebrospinal fluid. Then you end up having a lot of cerebrospinal fluid that is making your head, you know. So those are the three differences in this head injury. Yes, come the three differences in head injury. So when you're dealing with the type of head injury plus you add a headache, the type of head injury plus you add a type of headache, thunderclap is an immediate one, but progressive one shows there is several things that are undergoing. Progressive one shows there is several things that are undergoing. So headache after head trauma, like today you have a concussion, and then tomorrow you start having a headache. Please start to see a doctor. Go back to the doctor and explain. Headache with neck stiffness and few fever. Possible, you call knuckle rigidity. It's possible meningitis. Headache with vision loss or jaw pain. Adults, possible giant cell arteritis. Jaw pain. And some people have headache with, some people have headaches with locked jaw, tetanus. Persistent vomiting. We check on something that is called what? Migraine. We talked about, if you have not watched that video on migraine, please go watch it. For those that have recurrent headaches. New headaches during pregnancy after delivery. New headaches are during pregnancy or after delivery. They may be showing either problem with infections or problems with what? They may be showing problems with postpartum hemorrhage. A lot of bleeding after pregnancy is a sign you need to be taken care of. So, headache in patients taking anticoagulants, very important. Mostly women, check it. Go back to the doctor and to be advised, because you may be bleeding so much and you don't know. Losing blood from when you go to the loo, you have ulceration, you see bright blood. When you brushing your teeth, you bleed. Sometimes nose bleeding and you are on anticoagulant. Please see your doctor. Very important. Headaches in patients with cancer or weakened immunity is a sign you need to be checked very seriously. We have talked about immunity. You have cancer and HIV, immunosuppression. They are very important. Headache association with blood pressure and neurological symptoms like numbness, loss of vision. Neurological always say nerves are not working as they are supposed to be doing. So when the nerves are not working as they are supposed to be working, what is the issue here? The issue here is there must be a brain injury. Personal or behavioral changes. Personal or behavioral changes. Head injury. Confusion leads us to head injury. New headaches with seizures. New headaches with seizures. Second, brain injury. Need to be checked and be admitted and evaluated by your doctor. If there's some things that are very important to take when it comes to headaches. When did the headache start? When was the onset of the or gradual? Where is the pain located? How severe is it? From 0 to 10, your doctor will guide you. What is the quality? Throbbing, dull, thumping, or pressurized? How long does it last? Minutes, hours, seconds, days. What triggers and what relieves the headache? Any nausea, it will tell us the type of headache you have. Nausea associated with cluster headaches and migraines, not even tension type. Trigeminal, autonomic clusters. Any weakness, numbness, speech difficulty, or visual changes. These are important things to note. Fever or stiffness. I've gone through the previous history of headaches. Is there a pattern change? Current medications which you are taking. History or trauma, cancer or HIV. Now, physical examination is important. Vital sign, blood pressure, temperature, and those are vital signs. Temperature, blood pressure, and pulse. Complete, because sometimes when BPs go high, blood pressure go high, you may get a headache. If you have a head injury or a compression, you may have a head injury. Cranial nerve examination, the ones that have gone through the 12. Let me repeat the 12. Olfactory, optic, oculomotor, trochlear, trigeminal, abducens facial. 8, glossopharyngeal. And then we have, sorry about that. No, we have 8, vestibulocochlear, glossopharyngeal, vagus nerve, accessory, and hypoglossal. Those are the important 12 cranial nerve. Hope you took note about them. We check on fundoscopy and papilloedema to check the cupping of the eye. The cupping, I explained about it. Temporary artery examination in adult, and you can do if somewhere is swollen like the arm, the feet, you can do Doppler's ultrasound to check the arteries. Signs of trauma or infection like fever, you can check them. And when is it time that it shows that now this one needs to check an emergency? A patient should be evaluated urgently if they have sudden thunderclap headache. May be showing artery damage and bleeding. Hemorrhage. Headache with loss of consciousness, showing problem with the optic nerve. Headache with weakness, paralysis, or difficulty in speaking, problems with the glossopharyngeal nerve. And sometimes paralysis, the vagus nerve, and it depends with where the weakness is and which type of paralysis you have. This can be significant head injury. New headache during pregnancy with high blood pressure. Compensation mechanism. Loss of blood. High BPs, Yeah. Seizures accompanying the headache. Brain damage. Vision loss and double visions. And altered mental state and confusion. These are red flags and they should not be taken care of at home. You should go to a hospital to be checked. Let me repeat about the emergency types of headache as I'm ending. Sudden thunderclap headaches, headache with loss of consciousness, headache with weakness, paralysis, and loss of difficulty in speaking, headaches with fever and neck stiffness, persistent vomiting with severe headache, headache with fever and neck stiffness, infections, we talked about it. Severe accompanying the seizures, severe seizures accompanying headaches. Important. Go to hospital. Vision loss or double vision, seeing two things. Go to see a doctor. Altered mental status of confusion. Go to hospital. Don't say we are used to him like that. Welcome. Thanks so much to be here on those tips. Let's continue today. After this, we will be doing secondary headaches. Join me on my live always on at 16:30 p.m. Kenyan time. Yes, as we talk about medical history. Please, as you watch, if you have not subscribed, subscribe. And if you have a question, always post it. Or you have a topic each you want us to talk about it and interact with it. Talk to just pin it or email the email address that has been pinned. Always, we love everyone and protect life. Good. One love. See you at 16:30. May you be blessed. Bye bye. See you.